Good afternoon. My name is Lucy Aquino and welcome to CAN TV 21. Today you'll be watching an interactive show, a program of Hispano Care and affiliated with Illinois Masonic Hospital and Gottlieb Memorial Hospital. Today we have a very exciting topic that we're going to be discussing. And with me, our guest is Dr. Frank DiMaria from Advocate Illinois Masonic Wound Care Center. Welcome.
Well, thank you.
Thank you so much for being here. I know that today's topic is very interesting because with diabetes on the rise as an epidemic, the wounds that come from all of that, and the care that's required and needed, and all the information we don't know about. Interesting topic. Today we're going to be talking about PAD, peripheral artery disease. Did I pronounce that right, Doctor?
Absolutely.
So, Dr. DiMaria, thank you for being on the show today and sharing this wonderful information. Very informative. Our lines are open. So, if you'd like to call, lines are open from now throughout the show. You can reach us at 312-738-1060. The number is in the bottom of your screen. Dr. DiMaria, can you tell us what PAD is?
Sure. PAD is just an abbreviation, and it stands for peripheral arterial disease and refers to disease within the arterial system. And obviously arteries are throughout the body, but we're speaking more specifically about peripheral, meaning into the extremities. And so when the disease affects those arteries, patients will present with certain manifestations.
And when we're talking about PAD, and when we talk about peripheral artery disease, most people think, at least I do anyway, I think heart disease. Because of the artery part. Does it tie in that way?
It is. In fact, the pathology, the actual cause of it is very similar, except it's affecting a different organism. The heart muscle responds the same way. If with a myocardial infarction, a heart attack, there's poor flow to the heart muscle, pain becomes a symptom. Dizziness, palpitations. Well, the same thing happens in the periphery, and we can actually show the arteries to the periphery, the lower extremities, and the dark linear areas are actually the areas where the blood is flowing through the arteries into the extremities and supplying the muscles, the tissue with the necessary nutrients and oxygen to remain alive. Should you decrease that flow, there is a critical cutoff point where symptoms will begin, and then actual manifestations in the tissue and the skin will be seen. But symptoms are usually the first indicator that there is disease going on.
So Dr. DiMaria, why should people know about PAD? I mean, I know that it's one of those confusing diseases or illnesses that can happen, however you put that. But it is a confusing one because, again, we think about artery, we think of heart. But why should people know about PAD?
Well, because PAD can affect your lifestyle. And PAD can be also an indicator that there is disease above the belt. For example, we've already talked about the heart, and there could be to the brain. So it is a diffuse disease, and sometimes it manifests initially in the lower extremities, other times to the heart, other times to the brain. So recognizing these symptoms early can be a means to prevention.
And it is about recognizing the symptoms. Can we talk a little bit about what those symptoms are? Because I know that usually sometimes the leg pain goes away with exercise, and then once you stop exercising, it resumes again. And or people can actually confuse this pain for sciatica or arthritis. Can we talk a little bit about that?
Yes, the symptoms of pain may be not even pain, may be discomfort, may be fatigue. So you may be walking along and suddenly or gradually you begin to feel that, I can't take another step. I think I'll just sit and relax. And you sit, relax, you recover, and then you move on. And then you ignore it because it wasn't really limiting you tremendously. So it may be just fatigue. And then gradually, as the disease becomes more progressive and the caliber of the vessel closes more, less blood gets to that area, more symptoms begin to occur, and pain becomes a real symptom then, even at rest. So you may wake up in the middle of the night and actually have pain in your extremities, and this is an indicator of poor circulation to that area.
So if you wake up in the middle of the night, or if you're walking and all of a sudden you get this sharp pang or pang in your leg, what should you do? People would say, gee, it's a muscle, I just pulled a muscle. But what kind of pain is it? What should it be a call to action to the emergency room, for example?
Well, certainly if it's in the cardiac area, or if there are neurologic symptoms that are associated with it, one does need to move in a more emergency setting to have it evaluated. But when it's in your lower extremities, often it's not as much of an emergency that you need to go right to the emergency room. Of course, unless you are also noting that there is significant discoloration in a toe that's turned blue, and there's significant pain and discomfort with that, then certainly that needs to be looked at immediately. However, if it's just you're walking along, having pain, resting, it's relieved, you walk further, rest, I think it's time for you to see your private physician and have that assessed.
That's ongoing. Now, can your foot turn blue that quickly?
Yes, if there is actually what we call an acute embolus to that area, or it is the vessel is already about 80% occluded, it then becomes suddenly completely occluded. Yes, that is an acute emergency ischemic event, and that needs to be assessed.
Well, doctor, I know you have some photos that we'd actually like to discuss, and I'd like to share with our viewers. So if I may, doctor, let me just switch here a little bit and kind of bring some of this over to view. You can tell us about this one right here.
Well, as you can see, that the toes have a pellar appearance to it, and it's a white looking when I mention pellar, and then you can sense it at the border with the redness, or what we call the hyperemic event with this, and it's pretty much a reactive phase. But this blanching is an indicator that there is poor circulation to that area, and soon, if this is not corrected, we could go on to showing, and we'll show you a photo of wounds that are typical for peripheral arterial disease. And as you can see, the darkened area on the fourth toe, and the third and second and large toe, these are signs of peripheral arterial disease. Tissue is dying, and this needs to be evaluated.